This is Sherry Boschert reporting for Global Medical News Network. I'm at the annual meeting of the American College of Psychiatrists in San Francisco, where the internet, email, and social media were hot topics.
We were impressed when we began to look at this literature a year and a half or so ago, that although there is this literature for other fields, it was striking that within psychiatry education, there was very little to guide our education of the new generation of psychiatrists about how to think through the issues inherent in social networking and online behavior.
Could you give us an example of a scenario where a psychiatrist would be in trouble with social media or email? I mean, how can it create problems?
With email, I think without guidelines, interfacing with patients using email sets up all kinds of problematic boundary issues, expectations of availability, really unclear boundaries as to where to draw the line between what's manageable over email and what should be managed in a clinical encounter. And I think there's a slippery slope where it feels quick and easy to respond to an email, but rather quickly psychiatrists can find themselves embroiled in a very complicated clinical engagement without perhaps thinking about it as consciously or conscientiously as they should be.
When a mental health professional participates in a social network situation, they, by nature of that situation, choose to disclose certain things about themselves that might not be otherwise available to the people who they're treating, and raises some uncomfortable issues that can come up, such as, quote, friending, where the patient might put the mental health professional in a position of being asked, will you friend me? And then that person has to deal with it. And what I want to underscore that Dr. DeYoung and I are not suggesting that psychiatrists run from new technology and the internet, not at all. Just that we include in our education forums for thinking through it, so that people will have anticipated in their training these different ambiguous situations they can get into as they become involved in this type of communication.
We put together a set of 36 vignettes which focus on a bunch of different media and on a variety of different topics. So it covers things like confidentiality, liability, academic honesty, managing technology and psychotherapy, and so on. And for each vignette, we've included a list of resources.
Reporting for Global Medical News Network, I'm Sherry Boschert.